So, you know, when you see a commercial for a triple bacon cheeseburger, I think my stomach just growled, or a shiny new sports car and you just have to have it? Well, apparently that tactic works with cosmetic surgery as well, according to a new study by the American Society of Plastic Surgeons. First-time plastic surgery patients are directly influenced, it turns out, by the nip and tuck reality TV shows they're watching, whether it's Extreme Makeover or Dr. 90210 or my favorite, The Swan. More and more people are undergoing the knife or going under the knife after sitting in front of the tube. Jeff Gardere is a clinical psychologist, and Dr. Richard D'Amico is the president-elect of the American Society of Plastic Surgeons. Doctor, what's the danger of having reality TV influence cosmetic surgery?
Well, Joe, I think the danger is that patients may not be getting an accurate view of what goes on, what the benefits are, what the risks are. In essence, they may not really be getting reality.
All right. Well, doctor, you know, you're in the industry, and you certainly would like to have the flow of business. It keeps you going, just like I'd like to do more television and radio. Keeps me going. Why would you ever come out against people having plastic surgery? The more, the better, right?
Well, we're not against people having plastic surgery. What we're concerned about, Joe, is that people have an accurate understanding of the process, of the benefits, of the risks, of what their realistic expectations are. And that's the concern. And what the study showed was that people are actually influenced to have plastic surgery by these programs. And frankly, that puts a great deal of pressure and burden on the media, on the program,
Sure,
to get it right. And I think it also tells us that we need to do a little bit more education and reach out to the public more ourselves.
I want to grab a hold of that point, Jeff. You know, it's interesting to me, because I've watched these shows, but it's interesting to me that, you know, people don't really believe that within an hour span you get bigger breasts or a different nose or liposuction. They understand it takes 2, 3, 5 weeks, months, whatever it takes. It's a long, long process. Are they getting confused by watching it in such an encapsulated way?
Well, I don't think they're getting confused, Joe. I think, yes, certainly they see the nip and tuck and they don't see the edit that goes on. But what they see is the end product, and they don't see everything that goes into getting towards the end. The physical pain, the emotional pain, the readjustment to having this new look and how family reacts to that. So in some ways, they are cheated out of that. No pain, no gain in this case. And so that's not always the healthiest thing.
Well, Jeff, how often have you sat down with a potential client who wants to do plastic surgery and you did the psychoanalysis, you sat down and talked about it? How often have they ever said, you know what, you've helped me, emotionally get better, I'm not going to have it now? Not often, right?
Well, not anyone. What I've run into, but what I've run into are parents who have been looking to get perhaps rhinoplasty for their nose jobs for their kids, and we've been able to talk about perhaps they are much too young.
Yeah.
But what the plastic surgeons are doing, and I like this, is that they actually do screen them to make sure there's no body dysmorphia, to make sure that it's not a depression that's making them feel this way, to make sure that they are emotionally healthy enough and understand what the consequences and the results are. And for that, I tip my hat to the physicians.
Hey, doctor, I've got to ask you about that specifically. I mean, when somebody comes in and she thinks that she's too small up top or too big, or he wants to get, hair transplants or whatever's going on, I mean, do you sit down and actually go through a very long process and say, wait a second, you look fine, everything's okay? Maybe this is something else, and maybe refer them to a psychologist or a psychiatrist?
Oh, absolutely. In fact, the bulk of a consultation with a patient is not necessarily what to do or even what they want. That's usually quite straightforward. The biggest question we have to answer during a consultation is whether we should do any surgery on this patient, whether they have accurate expectations, whether their goals are realistic, whether we can deliver them what they really want and do it in an appropriate and safe manner. So this is a very big part of consultation, is understanding the patient.